like today to talk about Naltrexone implant in response to questions and comments I've been getting from viewers and some of my patients and their families. Welcome everyone again to the Doctor BMS channel, where we discuss health matters that relate to us, our families and communities. So the Naltrexone implant, I made a video in the past where I discussed how it works and how we use it in addiction rehabilitation. And just to recap, Naltrexone is medication that is used in addiction rehabilitation to help patients who are trying to overcome addiction to alcohol and many other drugs of addiction, particularly opioids. Opioids example are heroin, morphine, and the so-called the hard drugs, okay? And this drug is used extensively now as backup or support treatment to rehabilitation, so that you come into rehab and as you leave, you get your Naltrexone either as an implant under your skin to be dissolved slowly over time and help you for 3 months, for 6 months, sometimes 9 months, depending on the formulation, or as tablets or injections. So you can check the previous video description below to see more about Naltrexone. However, today what I want to talk about is a little more about how Naltrexone is to be used and it is not to be used. I've received questions from viewers, from prospective patients. Some of them ask, can I just come in and get Naltrexone? I don't have time to come into rehab. Some want to come in and after a short time, a week or two, they want to receive Naltrexone and go away. These are the issues I would like to discuss today, and I'll invite your comments, your reactions, your experiences at the end of this video after you've watched, so that I can respond more to this as we make more videos for the future. So, Naltrexone, it's a good drug. It is classified medically as an opioid receptor blocker, which works in our brain. And the opioid receptor blocker is going to stop the functioning of the opioid receptors. The receptors, opioid receptors, are found in our brain. And when we take drugs of recreation like alcohol and opioids, they dissolve into our blood. Whether we have drunk, we have snorted or injected, they dissolve into our blood and they circulate to our brain, and they attach to these receptors in our brain and they cause us to be happy. They cause euphoria. We feel nice, we feel energetic, elated. And this is why people call this recreational drugs, because you feel happy, relaxed, and you interact more with people. You engage more in your recreational activity. However, as I've said, they cause addiction. And this is the downside, that after some time, you seem to want them impulsively, you cannot stop, you stop functioning in other areas of your life, and you seem to just go for drugs, and now that is called addiction. So the opioid blockers like Naltrexone then will stop the interaction between the alcohol and the opioids, the drugs of addiction, with your brain, so that you do not derive that desire, that effect, the euphoria you used to have before. And it is hoped that this can help a long way in rehabilitation. So with that then, people ask, then why don't you just get someone and give them, and then it should work? And I would like to say now today that it does not work exactly like that, because the human body, the human is a complex creature. We are not just independent cells like brain cells working alone, and when they interact with alcohol and drugs of recreation, then a certain effect is felt. It is a mixture of all those cells of the brain serving different functions and producing our thinking, our behavior, our personality. And therefore, if you are going to have a drug that affects just a specific part of the brain or a few cells of the brain or body cells, then the effect of the other cells that are not affected directly will be brought to bear. And sometimes they may oppose the effect that the cells that are affected by this drug are producing. And this is the complexity that I'm talking about with humans. And it's in view of this complexity that we have observed that if a patient just comes in and you give them naltrexone, they get that blockade of the opioid receptors and they cannot derive that euphoria, that happiness from drugs. It seems to just partially solve the problem, because sometimes these patients are still wanting to get that feeling of happiness, that euphoria, that nice feeling. And so you have a situation where someone has taken something that is blocking them from getting what they are actively seeking to get. We have an antagonistic situation. We have two forces fighting each other, working at cross purposes. Therefore, our experience is that naltrexone is best given to patients who are already willing to change. They are motivated, they have accepted, they have learned how they can change, they are already practicing change, and then you give them naltrexone. So when it blocks these receptors, then it is helping these patients to achieve what they already want. So the patient's intention and the working of naltrexone form a team that delivers a result. This is as opposed to a situation where you get an unwilling patient who then you give naltrexone injection or an implant, and the next moment they go to the club, they are still drinking beer because they have not made up their mind not to drink anymore. But as they take, the blocking effect of naltrexone is already at play, and so they are not deriving the enjoyment they get from their alcohol, from their drug of recreation, but they still want that enjoyment. So what is going to happen? They are going to try and take more of this drug, of this alcohol, maybe mixed with a few more things, wondering what is happening, why am I not getting the high that I want? And at that point, you can guess that problems can start arising. For example, you can overdose yourself. This patient can take too much alcohol or too much of the recreational drugs to a level where they get poisoning. And I've discussed in previous videos that one of the risks of taking alcohol is alcohol poisoning. And acute alcohol poisoning can be deadly. It can cause patients to lose their lives within a very short span of time. Then we also have a situation where this patient, as they are fighting to overcome this blockade, which they are not in agreement with, they are likely to get more reckless in their behavior. As they seek this pleasure, they may spend more money looking for a magic to overcome this blockade. they may be amenable to manipulation, false directions from friends. Try this, do this, because they're looking for that high that the naltrexone is blocking. And in that recklessness, many things can go wrong, health-wise, like I've said, sometimes social, economic. And it's for this reason, therefore, that naltrexone is not recommended to be given to patients who are unwilling, patients who are unaware that they are using this, because it can turn to be dangerous. The second thing about naltrexone, which I would like to mention, is that we don't give naltrexone to someone if there is any residual drug in their system. For example, you took alcohol yesterday, the day before yesterday, you smoke marijuana or whatever, and you come in, you already are drunk or you have a hangover. We do not give you naltrexone. We will have to wait until this alcohol, these drugs get out of the system naturally by asking you to abstain for a period of time. It can go on for a week or so, or we can intervene medically and do what is called detoxification, where we aid the removal of the alcohol residues or the marijuana or the cocaine, whatever, morphine, amphetamine residues in your body through medical procedure called detoxification. It is only after we ensure that your body is clean from these drugs of recreation that we give naltrexone, the implantation. And the reason in simple and scientific terms is, like I've said, that when you give it and it is blocking the receptors, then it increases the chances of toxicity or the body reacting badly, because the metabolism is not going on well like it's naturally supposed to go. These recreational drugs are supposed to bind to some receptors. I talked of the opioid receptors, and through this binding, then it's supposed to activate mechanisms to metabolize it, to reduce it, to eliminate it from the body as you feel that euphoria. These things are going on concurrently. So when you cause a blockage, then you interrupt the natural mechanism of the body utilizing, metabolizing, eliminating this drug, and this can be deadly. There's also been a question about TSM. I think I will make a separate video about TSM. TSM stands for the Sinclair method. In the Sinclair method of addiction rehabilitation, we use naltrexone or these opioid blockers to preempt the good effect of the alcohol and the drugs of recreation that this person is used to, while at the same time exposing them to small amounts of these drugs. And the effect is that it desensitizes their brain, their craving, their wishing brain from wanting that drug anymore. Because how it works out, you know that when you go to the club to take alcohol, you'll take your sip and you'll feel nice and you'll start enjoying with your friends. So as that happens, there's a certain habituation that happens. There's a certain psychological dimension that happens, so that even before the drug comes, you can already anticipate what is happening and react to it. There's a famous experiment in biology called the Pavlov dogs. In the Pavlov dogs experiment, scientists observe that if you have a dog, a pet dog that you give food, whenever you come to give food, this dog, as it is seeing you, even before the food is visible. Maybe it is in a container, it is closed. Already these dogs start salivating in anticipation of the food. So scientists then said, well, let me come in, let's come in with the food, and at the same time, we ring a bell as we are giving the food to these dogs. Over time, the dog starts associating the bell, the sight of the plate of food, and the ringing of the bell. They are now lumped together and associated with feeding time. And then in the next phase of the experiment, the scientists removed the food and just rang the bell without the food. And they were surprised to see that the dog's reaction was the same as if the food was there, when in fact there was no food. They started salivating, wagging their tails, anticipating, yet there was no food. And so this is because there is a psychological association between events that happen concurrently. So in alcohol drinking, in recreational drug use, you go to your recreational place, and the moment you see the environment there, you see some friends, you hear some sounds, even before the alcohol comes, before the recreational drug comes, your body is already reacting to this. The anticipation is building, the enzymes are being produced, the salivation is happening, the anticipation. So this is what, in the Sinclair method, we are trying to desensitize you from this anticipation that you have built. And so you go to your recreation place, having taken a tablet of naltrexone. In the Sinclair method, mainly the tablets that are used, because they are short acting and you want to expose and withdraw and expose and withdraw until someone learns a new thing. So you take a tablet with a little dosage of the medication, and then you go and take your beer. The TSM, the Sinclair method, has been used mainly in alcohol, okay? So you take a tablet and then you go and take your alcohol, and you do not derive the enjoyment from alcohol like you normally do, because you have blocked the receptors having taken the naltrexone. And so if this continues over some time, then that association between alcohol and that ambience and the feeling good starts to get cut back. And it's through this that you get rehabilitated. So this is a second area of use in rehabilitation for naltrexone. And in this case also, we are using naltrexone in a controlled way and avoiding a situation where you can overdose yourself because you're trying to fight something that is in you but you don't accept. Okay? And so the message from these two scenarios, these two cases of usage of naltrexone, is that naltrexone is only to be used on patients who are willing, who are cooperative, and patients who are under the guidance of a qualified medical practitioner who can see the effects and modulate against over effects or side effects of naltrexone. Lastly, I would like to talk about side effects that have come up in discussion with our patients. Some people have asked, I hear when I take this naltrexone, it's going to affect me, and the area of libido is one of the areas that comes up. This is what I tell my patients when they come up with these stories. Basically, naltrexone has minimum side effects. There have been reports that it lowers libido, delays ejaculation, retards responsiveness in the sexual experience. There have been those statements, experiences from patients, but They are minimal. They can be overcome by many other therapies that are available. And what I have observed as I talk to my patients and get feedback is that usually if a patient has gone through rehabilitation well, they're feeling good about themselves, they are motivated to change, that feel good, that motivation, that anticipation for a new way of life, and the positive support that such patients will be getting from their family, including their spouses, is usually enough to overcome any side effects in the sexual arena that may be attributed to naltrexone. And so my patients who have used naltrexone, when they come back for review a month, 2 months later, they are all, I've not had a patient who has said he has a problem with libido, especially if this patient was in or is in a healthy relationship with their spouse and they're feeling good generally, that they have cast aside the old behavior of addiction to alcohol and drugs. They normally do well and report good progress in that area, which has led me to think that probably this report of reduced libido is not directly related to the chemical naltrexone, but perhaps it is the other associated psychological, social factors around alcohol addiction, drug addiction, what you were able to do before, and how your family, your spouse perceives you now. Because we know these drugs of addiction, they affect libido, and some of them can have very, very severe effect, like the Mirai users, some of them can become impotent. Alcohol, cigarettes, they can become impotent. So if you're coming from a situation where previously your performance was at 0, and now you've gone through rehab, maybe 3 months, 6 months, you may be expecting that magically you will move from 0 to 100%. And if you've not gotten good counseling, good support in rehabilitation to know that it's a gradual regaining of your sexual performance, then perhaps it's your expectations that may be a bit exaggerated. And now, having been given naltrexone, you may just be thinking that it's this drug that is causing this, when in fact, the drug is not causing it. The problem was already there. And if you allow yourself time and not build anxieties and remain motivated to climb the stairs slowly and not expecting a lift, you will get back to normal. Let me get what you think, my viewers. Some of you have used naltrexone, some of you have lived with people who have used this. Write the comments. Let's keep this conversation going, and we build better families for the health of ourselves and the community, the country at large. Bye-bye.